Hi everyone, I'm Suveksha. Today, my colleagues Milti Adish, Asmar, Vaishali, and I are going to talk about major depressive disorder and how we can treat it using cognitive behavior therapy and psychodynamic approach. We will talk about MDD, the psychological approaches, differences between them, and finally, how we can integrate these approaches. Starting with the introduction, major depressive disorder, commonly known as depression, is a mental health condition characterized by persistent feeling of sadness, hopelessness, lack of interest, or pleasure in all activities. The exact cause of MDD is not fully understood. However, it is believed that it is the result of combination of genetics, biological, environmental, and psychological factor. People who've lived through abuse, severe losses, and other stressful events are more likely to develop depression. Approximately 280 million people in the world have depression. Women are more likely to have depression than men. It is 50% more common in women. Globally, more than 10% of pregnant women and women going through postpartum experience depression. Moving on to the symptoms, a person with depression can have depressed or sad mood, loss of interest in activities that once used to be pleasurable, loss of appetite or eating too much, insomnia or sleeping too much, fatigue, psychomotor changes like feeling agitated or feeling like slowing down, feeling of worthlessness, difficulty concentrating, and finally, thoughts of death and suicide with or without plans or attempts. According to DSM-5, to diagnose a person with MDD, they should have at least 5 out of 9 symptoms I just mentioned, and for at least 2 consecutive week period of time. It should cause significant distress in their daily lives and should not be due to medical condition or substance abuse. It should not be explained by other mental health disorder and should not have a history of manic or hypomanic episode. Now, my colleagues are going to walk you through the psychological approaches and their differences.
So let's start by discussing the psychodynamic approach and its application in treating major depressive disorder. This approach has deep roots in Freudian theory and emphasizes uncovering unconscious conflicts and their impact on emotions and behavior. Unlike symptom-focused therapies, it seeks to address the issue's root causes, in this case depression, for example, by exploring an individual's inner world. In addition to a focus on emotions, psychodynamic therapy focuses on recognizing and addressing defense mechanisms. When, for instance, an individual may try to suppress memories of certain troublesome experiences. Let's see now some of the techniques used in psychodynamic therapy, starting with transfer analysis, which is used to help the client become aware of how their early relational patterns and expectations influence their interactions with others, including the therapist. It involves identifying and examining the emotional responses and attitudes a client projects onto the therapist, which often stem from unresolved relationships with significant people in their past. Then we have interpretation, which is a core psychodynamic technique, where the therapist offers observations to help the client understand deeper meanings behind their thoughts, emotions, or behaviors. By highlighting patterns, the therapist connects the client's present experiences to unconscious conflicts or past events. Psychodynamic therapy also uses free association. By allowing clients to direct the process, therapists encourage them to identify patterns and reflect on their feelings. And finally, projective techniques such as word association or ring block tests are also used to identify subconscious thoughts and feelings. Here you can see an example of a Rorschach test. Coming back to treating MDD, psychodynamic therapy is often used in the form of psychodynamic psychotherapy in the following way. Starting with building a therapeutic alliance, the therapist creates a safe, non-judgmental space where patients feel free to express their thoughts and emotions. This trust is crucial for delving into unconscious material. Then the next step would be exploring childhood and past experiences. The therapist and patient examine how early experiences influence current feelings of worthlessness or helplessness. This leads to addressing unconscious processes. Through techniques like the ones we saw before, free association and projective tests, patients uncover repressed emotions and learn to process them. Then, as the sessions continue, recurring patterns in the patient's thinking, feelings, and behavior will emerge. Often these patterns are subtle and unknown to the individual. The therapist helps the patient recognize these patterns and try to understand their significance and how they affect the patient's mood and reactions. Often discussing the patterns will lead to an examination of past experiences that continue to influence the present. Finally, we reach the integration and healing. Over time, patients develop greater emotional insight, improve self esteem, and gain the ability to form healthier relationships, reducing this way the depressive symptoms at their root. To conclude, until recently it was commonly thought that there wasn't any evidence to support the effectiveness of psychodynamic therapy. But over the last couple decades, research suggests that psychodynamic therapy not only can be effective, particularly for chronic or treatment resistant depression, but also offering longer lasting relief.
So, I will talk about the cognitive behavioral therapy for major depressive disorder. So let's start with a quick overview of cognitive behavioral therapy, or just CBT. CBT is a type of talk therapy that focuses on helping people with depression by showing them how their thoughts, feelings, and behaviors are connected. The idea here is simple. When someone is stuck in negative feeling, like thinking like I'm not good enough, it can lead to negative feelings like sadness and actions like avoiding social activities. This cycle can make depression worse. So CBT works by breaking this cycle. It teaches people how to identify negative thoughts, challenge them, and replace them with more balanced ones. This leads to more positive feelings and healthier actions, helping people manage their depression more effectively. CBT uses specific techniques to help people with depression. First, there is cognitive restructuring, which helps people to recognize their negative thoughts, like thinking things will not getting better anytime ever. The therapist helps them question whether those thoughts are really true and replace them with more realistic and positive ones. And next one is behavioral activation. Depression often causes people to stop doing things they enjoy, like seeing friends or pursuing hobbies. CBT encourages small, manageable steps to re-engage in those activities. Even simple things like going for a walk or calling a friend can make a big difference. Finally, CBT teaches problem-solving skills. Depression can make everyday challenges feel overwhelming, whether it's work stress, relationship issues, or financial struggles. CBT helps to break these problems into smaller steps so they are easier to handle. Why is CBT so effective for depression? Well, studies show that it works well for many people. It's not just about feeling better in the moment, it also teaches skills that help people manage depression in the future. Research has found that the people who complete CBT often feel more in control of their lives and experience, and this shows fewer depressive symptoms. For those with severe depression, combining CBT with medication can be especially effective. And one of the best things about CBT is that how it works for people of all ages, like teen, adults, and even older adults. It is also flexible, like you can do it one-on-one with a therapist, in a group, and even online. And CBT has a lot of strengths. It is practical and structured, so every session has a clear purpose. It doesn't just help with depression in short term. It also teaches life skills like to manage stress and emotions. Plus, CBT is flexible. You can do it in person, as I've said before, or online, or even through apps. But it is not perfect, for sure. CBT isn't a quick fix. It takes time and effort, so people need to be actively involved. It also doesn't work for everyone. For people with very severe depression or other treatments like medication might be needed alongside CBT. And lastly, CBT focuses mostly on the present, so it might not address deeper issues from the past that could also contribute to depression.
Now we are going to compare both the approaches. Each method has its unique perspective, technique, and applications. Let's explore the key philosophical differences. CBT view the mind as a system of thoughts and behaviors that can consciously be modified. Focuses on cognitive processes to shape present emotion and actions. Mental health issues are seen as stemming from distorted thoughts and behavior. So CBT targets these directly, aiming for symptom reduction through conscious changes. In contrast, psychodynamic therapy delves into unconscious processes, exploring how early life experiences and relationships influence the current behavior. It also identifies the symptoms as sign of unresolved unconscious conflicts, seeking emotional healing and growth by uncovering these deeper issues. Now let's look at the practical aspect of these techniques. CBT is designed to be a short term, typically consisting of 12 to 20 sessions. Each session allows for a clear agenda, and patients are often given homework assignments to apply learned techniques between sessions. This makes CBT a highly structured and goal-oriented approach. On the other hand, psychodynamic therapy is more open-ended. Sessions occur once or twice a week and can last for months or even years. This flexible structure allows for deep exploration of various topics as they naturally arise. Now let's see how these two approaches compare to each other in the treatment of depression. Both aim to elevate and promote healthier emotional states, but at the core of the approaches are their theoretical foundations which guide their understanding of depression. Psychodynamic approach views depression as a result of unconscious processes shaped by early experiences, some unresolved emotional conflicts, and internalized feeling of loss or rejection. This theoretical foundation lies in Freudian psychoanalysis, emphasizing the role of superego and the influence of past relationships on present emotional states. The goal is to uncover these hidden dynamics to understand the root cause of depression. CBT is grounded in cognitive model, which process it that distorted thought patterns directly influence emotions and behaviors, leading to depression. Focuses on identifying negative automatic thoughts and feedback loop between thoughts, feelings, and actions. The foundation of CBT is an evidence-based and emphasizes structuring these thought patterns to break the cycle of depression, making it more pragmatic and action-oriented. Throughout this discussion, we have explored how prominent approaches to treating depression and how they differ in their focus and methodology. Both approaches are effective and valuable, but the choice depends on individual needs, preferences, and the nature of the depression. Some may benefit from deep introspection and emotional exploration, while the others might prefer actionable strategies to manage their symptoms.
Adding up to the differences, now we are going to see how we can integrate these approaches together. While each of the approaches is different and effective on its own way, research have shown that combining CBT techniques with psychodynamic insights have improved the treatment outcomes and suggest that they can complement each other when integrated together. These approaches target different aspects of MDD. For example, CBT focuses on working with negative thoughts and behaviors to relieve the symptoms, whereas psychodynamic therapy look at deep emotional and relationship pattern. Combining both these approaches, we get a well-rounded treatment that addresses both short-term relief and long-term healing. So the timeline could go something like this. In the early phase, start with CBT to stabilize the symptom, while also introduce brief psychodynamic therapy to build rapport and identify relational pattern. In the middle phase, balance CBT intervention with psychodynamic methods and focus on linking cognitive patterns with emotional and relational themes uncovered during the therapy. In the final phase, use CBT to prevent relapse and reflect on psychodynamic insights to foster emotional resilience and deeper self awareness. To wrap up, depression is a serious but treatable condition. It's important to raise awareness and reduce the stigma so more people feel comfortable seeking for help. By making these effective therapies accessible, we can help individuals better manage their depression and improve their lives. That was all from our side. Thank you for watching.